In this presentation, we will review the key concepts of the so-called Leave No One Behind commitment of the Sustainable Development Goals. We will also recommend ways to integrate this commitment in designing and implementing development interventions to ensure that, in fact, no one is left behind and everyone is able to participate. We will first have a look at what inclusion is. We will continue by discussing the different dimensions in which people can be excluded and how these dimensions can overlap. After that, we explore the barriers that exclude individuals or groups from the rest of their families, societies, and even the world, and how removing these barriers can ultimately lead to full inclusion and participation. Lastly, we look at the actual practice of our work. How do you integrate leaving no one behind in the interventions you designed and execute? So why is it important that we leave no one behind? With the adoption of the 2030 Agenda for Sustainable Development on 25 September 2015, the world embarked on a 15-year transformative path to secure peace and prosperity for people and the planet. The 2030 Agenda sets out 17 Sustainable Development Goals, or SDGs, which are an urgent call for action by all countries, developed and developing, in a global partnership. At the heart of the 2030 Agenda lies a commitment to leave no one behind in the process of development, with a special recommendation to prioritize furthest behind first. As such, Leave No One Behind, or LNOB, is intended to be mainstreamed in all the SDGs. In addition to a commitment to leave no one behind, a specific SDG has been dedicated to reducing inequalities within and among the countries, SDG 10. Before looking at how we can achieve Leave No One Behind, it's good to see how human rights and Leave No One Behind are related. The vision statement of the 2030 Agenda seeks also a world where the human rights of all are realized. This means that in addition to their political commitment to leave no one behind through the SDGs, states have acknowledged again that they have a legal obligation to ensure the realization of human rights for everyone without discrimination and through their meaningful participation. Human rights are universal and apply to all humans. Equality and non-discrimination are core principles of human rights, and so are participation and accountability. Now, let's have a look at the basic requirements for achieving leaving no one behind. Addressing discrimination and leaving no one behind requires developing the awareness and skills to recognize one's own prejudice. It means you are able to identify grounds for discrimination and barriers to inclusion in the context of your work. It requires support for individuals and groups in disadvantaged or vulnerable situations to become more assertive to demand their rights. For policy and advocacy work to address institutionalized discrimination resulting in exclusion. And lastly, a joint commitment to work towards removing all the barriers. One of the key concepts that we see as a foundation for achieving Leave No One Behind is inclusion. But before we look at what inclusion is, it's useful to clarify what inclusion is not. Inclusion is not just about improving access to facilities and services. It entails empowering people to participate in wider processes of decision-making related to them at their homes, communities, and beyond. These quotes from two thought leaders on inclusion and diversity can also help elaborate on what inclusion is or isn't. Verna Meyer says, "Diversity is being invited to the party. Inclusion is being asked to dance." Daniel Jude believes inclusion does not mean that someone else has to invite you for a dance. Inclusion means that you are on the committee that's organizing the party. One of the first steps we can take in achieving inclusion is to understand better what exclusion is and how it works. Exclusion is a state in which certain individuals and/or groups unable to participate fully in different aspects of life as well as the process leading to and sustaining such a state, or in other words, face discrimination. Different dimensions of an individual's or a group's identity might contribute to their exclusion. The most common dimensions, also known as the prohibited grounds for discrimination, are gender, racial or ethnic origin, religion or belief, age, disability, sexual orientation, or language. Exclusion exists at the global level, within countries, within communities, and within households. To really understand the different dimensions of exclusion, we need to enhance our knowledge of how people from diverse backgrounds and locations may experience life differently. Let's try to understand these dimensions better by dividing them into three categories. The first category includes spatial factors, which relates to difference in experiences based on where one lives. For instance, if you live in a remote rural area in an informal setting or in a fragile state, you are more likely to experience being at a disadvantaged position and left behind. The second category includes experiences of exclusion that are related to the population group that one belongs to. For instance, your religion, ethnicity, language, politics, or even your occupation or your migration status can cause you to experience a disadvantage or advantage. Now, the third category is about individual factors that affect one's relationship with power and one's ability to take decisions and have control over resources. These individual factors are gender, age, physical or mental ability, and health status. You can experience more or less disadvantage and exclusion depending on the social norms, beliefs, and culture of the society you live in. Surrounding these circles, we also have power, poverty, and life cycle, which have influence on all of the other factors we mentioned. Here we come to the idea of intersectionality, which is an important concept, and you can see it in this place where all these three cycles intersect. The term intersectionality comes from the women's movement and first appeared in an article in 1989 on the exclusion of African American women from women's equality struggles. Intersectionality means that when different aspects of one's identity overlap, it can increase or decrease the disadvantage one is experiencing. For example, if you are a woman of age and you have difficulty walking, but on the other hand you are from a rich family in a modern city that has proper access to services such as water and sanitation, you have a very different experience compared to when you are from a low-income household in a remote area and you have to walk long distances to fetch your water or access a toilet. Having understood the different dimensions of exclusion and intersectionality, it's important to also understand how these create barriers to inclusion and cause people to be left behind. Barriers are internal and external factors that can limit one's functioning. And although the specific barriers may differ across groups, we can divide them into four main categories. Environmental barriers are physical barriers in the natural or built environment. Examples can include narrow pathways and uneven surfaces, public services without proper lighting and access, as well as inaccessible communication systems. Institutional barriers include laws, policies, strategies, or practices that discriminate. Such barriers are often linked to social and cultural norms and incorporated into policies and legislation. This makes them very difficult to identify. Attitudinal barriers are negative attitudes, prejudices, and discriminatory behavior by family or society, social practices, traditional beliefs towards specific groups or individuals, and they are one of the greatest obstacles to achieve inclusion. Examples of these barriers can be the belief that women are homemakers and can't contribute to the betterment of their community, or that people from a specific ethnicity are cursed and not allowed to enter public places. And then we come to individual barriers. The repeated experience of facing discrimination and exclusion due to previously mentioned barriers can lead to internalized stigma, low self-esteem, shyness, and/or fear in the individual, and it can prevent progress towards inclusion. They can cause the people in disadvantaged situations to believe they are worthless, dependent on others, and in need of support. This cycle of dependency might be difficult to break down. Although lack of capacity in first instance might seem as an individual barrier, however, we believe that when provided with the right opportunities and resources, everyone can fulfill their potential. Therefore, when noticing limited individual capacity, we need to look deeper for barriers which have prevented the person to develop their full potential, including our own bias that prevents us from seeing the potential in others. In our interventions, we need to, as much as possible, address all the barriers and be mindful of possible negative risks and need for measures to mitigate them if the progress does not go hand in hand. For instance, if there are institutional barriers such as discriminatory laws against those with different sexual orientations, encouraging individuals to freely talk about their sexuality, but without providing them with the necessary protection and legal support, can actually put them in a higher risk of violence.
These barriers to inclusion can feel almost like brick walls. Consultation with women and those in disadvantaged situations is an essential part of trying to identify which barriers exist. Once we know what these barriers are, they can be challenged and broken down.
Let's have a closer look at how removing barriers can lead to inclusion and leaving no one behind. As we said, inclusion is not just about improving access to services for those who are currently excluded, but also about supporting people to engage in wider processes of decision-making to ensure that their rights and needs are recognized. Acknowledging that people are different, have different experiences of discrimination, and face different barriers to inclusion, it is obvious that they need different sorts of support and resources to ensure their rights are realized. Ideally, we need to strive that the barriers causing inequalities will be removed to reach inclusion. But if removing the barrier is not possible, at least measures must be taken to compensate for specific discrimination and disadvantages, or, in other words, the realization of substantive equality. This means that everyone enjoys equal opportunities and control. For instance, although eliminating poverty as a barrier to inclusion might need longer-term interventions, realizing substantial equality can become possible through the provision of services, such as water, health, energy, etc., in affordable and accessible ways to the low-income population.
A big step towards inclusion is made by identifying who is facing discrimination and is left behind, and which barriers they face. The next step is taking action to remove these barriers. But not all actions guarantee that inclusion will be achieved. Inclusion can be seen as a transformative process in which we strive to achieve the highest outcome possible. The transition to inclusion can be seen in 4 stages. Stage 1 is exclusion. This takes place when actions focus solely on a target group and can increase the stigmatization or reinforce the stereotype that the general population has towards these groups. An example can be a project that increases access to water only for people with a disability in a community where actually no one has access to water. Stage 2 is called component or segregation. This happens when actions include a consideration to the specific needs of a specific target group, like women or people living with HIV, without any interaction with the mainstream activity. This will not contribute to stronger inclusion and won't change the attitude of the general population. Stage 3 we call integration. This happens when actions consider diverse needs and rights of different groups and involves the design and planning of services and facilities that respond to the particular needs of different groups, such as women or persons with disabilities. These services or facilities are inserted into mainstream programs and budgets, but they will not address the root cause of exclusion and discrimination. An example could be the introduction of special classes for children with disabilities within the mainstream schooling environment and under the same educational administration, as opposed to a segregated situation. And finally, stage 4 is inclusion. This takes place when we address the root causes of exclusion and involve those in disadvantaged situations as equal partners in the design and execution of the action, through the appropriate adaptation of mainstream facilities and services. A specific support service component may sometimes be needed to empower those in a disadvantaged situation. For instance, a pupil who is deaf can follow the same curriculum in the same classroom as his or her peers, but with the help of a sign language interpreter.
Consultation with women and those who face discrimination and exclusion is an essential part of trying to identify which barriers exist. This leads us to the most important principle to achieve inclusion and leave no one behind, which is nothing about us without us. Without active and equal participation of all relevant actors, in particular women and those in disadvantaged situations, we will not achieve inclusion. Taking into account that an important principle in achieving inclusion and leaving no one behind is ensuring that people engage in the processes of decision-making related to them, and keeping in mind the principle of nothing about us without us, brings us to the concept of the participation ladder. It's important to keep in mind that when talking about participation in decision-making processes and nothing about us without us, we don't mean the token participation. We are not happy with, for instance, only inviting women, girls, and those in disadvantaged situations to the meetings. We are also not satisfied when they participate but are not able to contribute or are not listened to. In order to reach inclusion and leave no one behind, we should aim for the highest level of participation, where women, girls, and others who face discrimination and are left behind are able to influence the decision-making and preferably make the decisions and rules which directly affect them.
Now that we've looked at the theory of inclusion, let's move on to a recommendation for an operational model to integrate inclusion in different steps of the program cycle, which includes guiding questions that we need to ask ourselves. During the assessment phase, we need to ask ourselves, who are likely to be left behind? And in what sense are they left behind? Is it about access to or use of water, about sanitation, hygiene, about maternal health, menstrual health, or access and or control over resources or decision-making processes? Which setting are we talking about? Is it rural, urban, or peri-urban? What is the scale? Is it a majority of the population that is left behind, or are there smaller percentages that are known as the last mile? And how is their relationship with those in power? Next is, what do those left behind see as the barriers to their inclusion, and why? Who benefits from their exclusion? Who has the resources, the responsibility, the jurisdiction to address the barriers to inclusion? And lastly, what evidences do we have for our answers? During the planning and design phase, answering below questions will help us be more inclusive. How can right holders and duty bearers be strengthened in their roles and responsibilities to improve inclusion? How can the inequalities in terms of service delivery levels or access to products be overcome? How can women and those who are currently facing discrimination and are left behind climb the participation ladder and participate in decision-making processes related to them? How to remove the barriers to inclusion, in particular the attitudinal and institutional ones? And lastly, was the nothing about us without us principle followed in answering all of the above questions? Or were the women and those often left behind actually involved in the process? If not, we need to try again. During the actual implementation phase, questions that need to be addressed include: does the implementation include all the relevant stakeholders, including the government, local government, and women and those who are currently left behind? Do the contractual agreements include certain clauses on how to address barriers to inclusion in the implementation program? Do the implementers have the right attitude towards women and those who are currently left behind? Do they speak the same language? Are women and those who often face discrimination actively engaged in implementation and as equal partners? When we are monitoring, we need to check: do we have explicit policy goals and specific targets for inclusion? Are indicators, disaggregated data, and methods which are needed to identify barriers to inclusion and track improvements included in the monitoring system? Is the monitoring process inclusive and accessible, and does it capture the feedback of women and those often left behind? Are those who are supposed to benefit from the program benefited as envisioned? How is the attitude and practices of those in power and those benefiting from exclusion changing? And lastly, are women and those who are benefiting from inclusion facing any higher risk of violence? And as a last point in the program cycle, to ensure learning is properly captured, we need to control whether experiences are being documented and shared, and how the evidence is used to inform and improve policies, practices, and approaches to become more inclusive and contribute to removing barriers to inclusion. However, none of the previous steps will be successful if the necessary resources are not provided for a proper integration of inclusion. The resources also include strengthening the capacity of all stakeholders to be able to play their role in removing the barriers to inclusion. Therefore, it is essential to ensure those involved in different steps of the program are supported to understand better their own biases and prejudices towards those who are often left behind. To check what is needed in terms of capacity, skills, time, budget, etc., to reach inclusive results. To make sure those sufficient resources are available and the available resources are effectively used to address the barriers to inclusion. So let's review some of the key concepts we discussed. The first step towards inclusion is identifying who is left behind and why. This is not always easy, as those who are left behind can be invisible. To understand why they are left behind, we need to follow the nothing about us without us principle, meaning we work together with those left behind in identifying and breaking down barriers to inclusion. As inclusion and exclusion are about power, in order to structurally remove the barriers, we need to make sure everyone has the resources, agency, and opportunities to empower themselves and climb the participation ladder. We also need to keep in mind to plan and budget for inclusion, be mindful about our own biases and prejudices, and see inclusion as a joint responsibility, so everyone needs to be willing to adjust continuously in order for us to fulfill our Leave No One Behind commitment.